Hello, friends, and welcome to the Autoimmune Recovery Room. I am so glad you're here. My name is Diana Carroll, and today we're going to gently walk through the common lab tests and what they often mean when you are dealing with autoimmune conditions. My goal is to explain the words, what doctors are usually looking for, and what questions to ask, all in plain language. This is not a replacement for your clinician, but it is meant to help you understand and advocate for your health, and something I only wish I had access to when I started my journey 62 years ago. As always, before we get started, I must remind you that this video is for informational purposes only, and it is not a substitute for medical advice, diagnosis, treatment, or pharmaceutical guidance. Always, always consult your healthcare provider for any health concerns you may have. Understanding your labs and reports is empowering because it helps you see what is really happening inside your body. Ask clear questions and partner with your doctor instead of feeling left in the dark. Labs are only part of the story, but knowing what they mean in plain language gives you confidence and helps you make informed choices about your care. To be very transparent, some of the things that the names, like autoimmune diseases, are unbelievable, and I will mess up on them, but that's okay because I'll have the definition to go along with it. And I want to tell you that for years now, I am fortunate. I usually get my lab work done from LabCorp, and I am a member, so I get access to them, so I don't have to ask the doctor for them. But I keep them, and I look from one test to another to see if it's gone up or gone down. But I did not, until I did this research, understand what those letters meant. 3 little letters here, a code here, and have no idea. I just knew it was up this time or down that time. So I'm hoping that this will help you as well. So number 1, decoding labs and tests. Your labs are just clues. Understanding them helps you feel less afraid and more in control of your healing story. So just a quick roadmap as to what I'm going to cover. And number 1, why doctors order tests for autoimmune problems. Number 2, common tests and simple explanations. Number 3, how labs are interpreted, why context matters, what to ask your clinician. And number 5, practical steps and safety red flag signs. So number 1, why labs matter. Simple. Labs are tools. They give clues about what is happening inside your body. Some show inflammation, your immune system being active. Some show damage to specific organs. And some look for specific antibodies, little flags your immune system may have made that point to particular autoimmune diseases. But one test really tells the whole story. So doctors put labs together with your symptoms and exam. Number 2, common labs explained by plain language, hopefully. A CBC, complete blood count, tells about red cells, oxygen, white cells, infection, inflammation, and platelets, whether they're clotting. Low or high values can point to anemia, infection, or bone marrow effects. A CMP, basic metabolic panel, liver test, chemistry panel, checks kidneys, liver, electrolytes, blood sugar, and proteins. Helps see if organs are affected or medications are causing changes. ESR, erythrocyte, told you I was going to mess up, sedimentation rate, and CRP, C-reactive protein. Both are general inflammation markers. Think of them as inflammation thermometers. Higher means more inflammation, but not why. CRP changes faster. ESR is slower. ANI, anti-nuclear antibody. A common screen test. If negative, many autoimmune diseases are less likely. If positive, it is a clue that the immune system is making antibodies against the nucleus of cells. But a positive ANA needs more context. Many healthy people can have low-level positive ANAs. So what I'm hoping to do, because as I said to you in the beginning, I look at my blood work every single time I get it done. And I get blood work done from 1, 2, 3 different doctors. So I may be looking at blood tests every month, every other month, or every 3 months. But I compare them, and I want to know what's up, or when it went up or when it went down. And I ask the doctor, and sometimes I get explanations like, oh, don't worry about that. And that annoys me to no end. So I pursue, and I ask, what does that mean? Okay? Where did I leave off? So then there are ENAs, specific autoantibodies. These are more specific than ANA. Certain patterns point toward specific diseases like lupus or Sjogren's, which I have. A positive specific antibody is more informative. RF, rheumatoid factor, an anti-CCP. Used when rheumatoid arthritis is suspected. Anti-CCP is more specific than RF. Presence suggests autoimmune arthritis, have that, but still must be correlated with symptoms. So you may be seeing these things on your blood tests. Hopefully you are looking at them and not understanding what it means at all. And sometimes we get the white coat fear of how dare I question the doctor, but how dare you do not. Thyroid antibodies, anti-TPO. If you have fatigue, weight changes, hair loss, mood shifts, these look for autoimmune thyroid disease, Hashimoto's or Graves'. I happen to have had both. Vitamin D, often low in people with autoimmune diseases. Low levels can worsen fatigue and immune dysregulation. Excuse me. Many clinicians supplement if low. So again, these are things you want to know. Being an African American, it's important to have your vitamin D without an illness, without an autoimmune disease. So to have one, it's even more so. Ferritin, iron studies, is a storage protein. Low means low iron. High means inflammation, important for fatigue. ANA patterns, titers, and positive versus negative. Labs sometimes report a titer, how much the blood must be diluted before the antibody is no longer detected. Higher titers are more likely to be meaningful. The pattern speckled sometimes helps experts understand what's going on in your body. Then there's a HLA-B27, a genetic marker positive in many people with certain inflammatory back-hip conditions. But lots of people with the marker never get the disease that coincides with it. Hepatitis panels, HIV, Lyme, celiac. Some tests check for infections or gluten-related immune responses that can mimic, or trigger autoimmune symptoms. Urine analysis, and urine protein looks at kidney involvement, important in some autoimmune diseases. Just had one, just did it, had to do a 24-hour test, and just turned that in yesterday. Other specialty tests: anti-mitochondrial antibody, anti-smooth muscle, ordered when liver autoimmune disease or other specific organ involvement is suspected. Number 3, how to interpret a result. The fourth rule of thumb. Number 1, numbers need context. A slightly high CRP with no symptoms may be less concerning than a very high CRP during a flare. Number 2, one abnormal test really equals a diagnosis. Patterns plus symptoms plus exam plus sometimes imaging or biopsy make the diagnosis. So I don't want you to look at it and go, oh my God, it's high or whatever. There's a lot of things that go along with that, okay? But I just want you to be aware of what's going on in your body and what's going on when you get blood tests. And sometimes we don't even ask for a copy of it. Number 3, normal labs don't always mean healthy. Some autoimmune conditions do not show up on early tests. Lab changes over time. Trends matter more than a single reading, which is why not knowing, I was ignorance on fire. That's just the bottom line. I just knew that I wanted to look to see. I mean, when I tell you I've had some numbers that were in the thousands when it wasn't supposed to be no more than 100, panic rises, and I don't even understand what the actual test is for. And when I ask the doctor, I get, oh, don't worry about that. What do you mean don't worry about it? So you have to take your life into your own hands, alongside with your doctor. Don't be ignorant to this is your body and your health. Number 4, some helpful questions to ask your clinician. Number 1, why are you ordering this test and what could it show? Number 2, what would an abnormal result mean for my treatment or next steps? Number 3, can you show me the exact number and the lab reference range? And see, when you are looking at your own report, most of them will give you a range, the good range you're in and what range you don't want to go above. If the test is normal but is still systematic, what then? Those are questions you need to ask. Do I need follow-up tests or a referral to a specialist? Number 5, practical steps and what to watch for. These are your action steps. Number 1, keep a simple symptom log tied to test dates: fatigue, joint pain, rashes, and fever. Trends help interpretation. So if you get a test and you know that you've been having a flare or you're feeling really fatigued, you got joint pain, and then you look at the test, okay, so you need to give that information to your clinician so that could help them interpret what in the world is going on. Bring a family member or a notebook to the appointment to capture the explanation, because I promise you, you will not remember what was said. It went in and it came out. And if it's scary, the only thing that stays in is the scary part. So have someone with you or make sure you're writing down notes. And I'll tell you what a wonderful, wonderful, when I first was diagnosed in 1980 with sarcoidosis, my doctor told me, if you are with a doctor and they cannot explain to you so that you can understand, you need another doctor. Now that was a doctor, and I was with him until he retired. Okay? And I have been very forceful with some of my doctors, because if you won't even give me the time to explain to me so that I understand, then I need to find somebody who can do that. Okay? That's just me. That's just me. Ask for copies of your lab report if you're not, like I said, I do most of my labs with LabCorp, and I can go automatically. In fact, when they're ready, they notify me that the reports are ready. But if you don't, ask your doctor for a copy of the lab reports and keep them in one folder so that you can look from test to test. If a test is abnormal and you feel unwell, a fever greater than 101, shortness of breath, sudden weakness, chest pain, get to urgent care, ER. Don't play around. Don't be like me. Consider a second opinion if the tests are confusing or your symptoms are being minimized or your clinician is not willing to spend the time to make you understand. That was one thing about Dr. K-Back. I did not leave his office until I thoroughly understood what he was saying to me. In closing, my loves, I give you all the encouragement I can, because it's important for you to understand what's going on in your body. You are your own best advocate. Labs are powerful, but they are part of a bigger story. Your symptoms, your life, and your values. Bring this knowledge to your appointments. Ask for clarity. And remember, it is okay to slow down the conversation until you understand. You are brave for showing up for your own care. And know beyond a shadow of a doubt that this warrior right here, I got your back in any way I can. Know that I love you. I appreciate you from the depths of my heart. And until next week, stay blessed, stay encouraged, and know you are loved and appreciated. Wishing you God's blessings upon each and every one of you. Please like, share, make a comment. Love you to death. Bye-bye.